part of the national webinar on social work profession and COVID-19 pandemic, organized by the School of Behavioral Sciences, Mahatma Gandhi University, Kerala, in association with Social Work Departments of GEMS Arts and Science College, BVM Holy Cross College, and AWH Special College, Kerala. We all know many things have drastically changed since the commencement of COVID-19 crisis and lockdown. I think one of light is the difficulty the lockdown often gives to the social workers in various different aspects of our profession. And today we shall discuss about the social work on the context of pandemic through two different sessions on social workers and occupational stress and vulnerable groups and COVID-19. We expect all your active participation in the sessions. Moving on to welcoming all of you to the program, I cordially invite Mr. Arun M., coordinator of today's program, NSWPC 2020, and faculty of Department of MA Social Work in Disability Studies, School of Behavioral Sciences, Mahatma Gandhi University, Kottayam, Kerala, for the welcome address.
Good morning, everyone. Am I audible?
Yes, sir, you're audible.
Okay. Respected Chairman of the program, Professor Rajiv Kumar N. Honorable MLA Sri Manilankuri Ali Sir. Honorable Vice Chancellor, Professor Dr. Sabu Thomas Sir. All the other dignitaries, research colleagues, students and friends. It's a matter of immense pleasure to have this opportunity to welcome you all to this national webinar organized by School of Behavioral Sciences, Mahatma Gandhi University, in association with Social Work Departments of GEMS Arts and Science College, Malappuram, BVM Holy Cross College, Cherpungal, and AWH Special College, Calicut. It's been a while since we have been due to the COVID-19 pandemic. This minute organism has forced us to change our. In this context, the topic of our webinar, social work profession and COVID-19 pandemic, is very relevant. Today, we are privileged to have eminent personalities in our midst. My duty is to welcome all our dignitaries and the participants to the webinar. Professor Dr. Rajiv Kumar N. is chairing today's webinar. He's the director of School of Behavioral Sciences, Mahatma Gandhi University, Kottayam. He has been our guide and constant support in organizing the webinar. I take this time to extend a warm welcome to Dr. Rajiv Kumar N. Welcome, sir. We are really privileged and happy to have Sri Manilankuri Ali, sir, Honorable MLA and ex-minister, and Chairman of GEMS Arts and Science College, Malappuram, with us, who has agreed to inaugurate the webinar. Being a people's representative, sir will be able to give us a lot of practical advices related to our topic. On behalf of all of you, I extend a hearty welcome to Sri Manilankuri Ali, sir. With great pleasure and honor, I would like to welcome the Honorable Vice Chancellor of Mahatma Gandhi University, Professor Dr. Sabu Thomas sir, to this webinar. In spite of all his busy schedules, he agreed to be with us, and we will listen to him delivering the keynote address for the day. Welcome you, sir. Dr. Mushtaq Rahman TM is the Vice Chairman of NSWPC 2020, and he's the head of the Department of Sociology and Social Work, GEMS Arts and Science College, Malappuram. We are very grateful to him for his tremendous support to him. He has provided to this webinar. Dr. Mushtaq sir will elaborate on the scope of this webinar. Welcome, sir, to this webinar. It's my great pleasure and honor. I welcome our speakers today who are going to speak for us. I welcome Mr. Francis Moothedan Raphel. He's the Project Director and Chief Trainer, MMM IRCA, MOSC Medical College, Kolenchery. Welcome you, sir. Next, I would like to welcome Dr. Alan Godfrey. He's the Assistant Professor of St. Joseph College, Bangalore. Welcome, sir. I warmly welcome Mr. Sujay K. is the head of the Department of Social Work, AWS Special College, Calicut. He is going to present the concluding remarks of the webinar. Welcome, sir. The vote of thanks of this program will be delivered by Mr. Sajo Joy. He is a faculty of Department of Social Work, BVM Holy Cross College, Cherpungal. I extend a hearty welcome to Sajo sir to this program. A warm and hearty welcome to Dr. K. M. Mustafa, Faculty of Behavioral Science and Director, IRLD Mahatma Gandhi University, Kottayam, Captain of Organizing Committee. We are really happy to have you here, sir. Welcome to you, sir. I welcome Mr. Arun K. He's the Vice Chairman of NSWPC 2020. He's the Assistant Professor of Department of Sociology and Social Work, GEMS Arts and Science College, Malappuram. Welcome you, sir. I'm really happy to welcome the moderator of the webinar and all the technical and communication committee members who are working at the backstage. Welcome all. I realize that many professionals, research scholars, students, and teachers are participating in this webinar. Dear friends, you are the strength of this program, and on behalf of the organizing committee and my personal behalf, I've extended a warm welcome to each one of you to our webinar. I hope and believe that these few hours will turn out to be a great experience for all of us. Let me conclude my words. Thank you.
Thank you, sir. Thank you for your valuable words. It was indeed a pleasurable welcome for all of us. Next, we have Dr. Rajiv Kumar N with us. Dr. Rajiv Kumar N is a professor and the director of School of Behavioral Sciences, Mahatma Gandhi University, Kottayam, Kerala. I invite Dr. Rajiv Kumar N for the presidential address.
Hello. Am I audible to all?
Yes, sir, you are audible.
Okay. Thank you. Good morning, all. Today, we are hosting the national webinar on social work profession and COVID-19 pandemic. So, before going to the webinar, I'd like to say a few words about how our Mahatma Gandhi University, especially the School of Behavioral Sciences, has contributing to the difficult times, as well as how the academic and research activities of School of Behavioral Sciences are contributing to our society. Before going to that topic, I'd like to invite all the dignitaries, our honorable, the program is accepted to inaugurate and inaugural address by Mr. Manjalangudi Ali, honorable MLA and chairman of James Arts and Science College. I welcome, sir. And our professor, our vice chancellor, honorable vice chancellor, Professor Sabu sir has accepted to present a keynote address. And the resource person of our webinar, Dr. Nishad Rahman, Mrs. Anju, and Mr. Francis Moothedan Raphel, our faculty Arun K is here, Dr. Godfrey, and Suresh. These are our people actually leading the webinar. I welcome all of you, as well as I welcome the participants. You know, I came to know that about 1,000 participants across our India, from Kashmir to Kanyakumari, were participating in this webinar. I invite all of them, each one of them, for an active, sorry, for an active participation and in this webinar. Let me talk about a few words about our School of Behavioral Sciences. Actually, the School of Behavioral Sciences was instituted 1988 with a unique objective, that is objective of addressing social issues in a behavioral perspective. So we have a team, a faculties in that perspective. Of course, in our current thinking of addressing social issues in a comprehensive way, like every well-being or health issues or mental health issues, whatever it may be, it's in a biopsychosocial model, addressing comprehensively every aspects that determine the well-being of the people. So in such a perspective, the School of Behavioral Sciences have departments of behavioral medicine, rehabilitation nursing, rehabilitation psychology, special education. We have a social work department, and of course the other supportive departments we have in address the social issues like the disability as a major theme, or health issues as a theme, and conduct research and extension activities in that area. So far, as a result of this view, in this perspective, we have several programs like MPhil program, PhD program, PG programs are chartered. Like we have a social work in disability rehabilitation. 1 minute. Okay, sorry. So in such a way, we have our the programs. And so, considering the social work as a department, in a rehabilitation process or addressing the social issues of diverse conditions like, sorry, 1 minute.
Hello, Adira Shashindran, can you please stop presenting? Rajiv sir, you can continue. You are on mute. Hello, sir.
Rajiv sir is on mute.
Uda, what is happening?
I don't know, sir. Some technical issues, I guess.
I think he has unmuted, you know. I don't know.
He's still muted, sir. He's still muted. Rajiv, sir.
Time is going waste,
Yeah.
Bashad.
Yes, sir.
Because when you have a programs in between, if the talk telephone come, you should not attend.
Yeah.
Whosoever it may be. I'm very particular about that.
Yes, sir. Sorry,
I'm
sir.
attending this only for this purpose, to be honest.
The sir is coming, sir.
Hello. A small little disturbance okay, as our honorable vice chancellor is trying to join with our meeting. So some communication difficulty was occurred. That is why I just missed from this. So the School of Behavioral Sciences contributing such a way, like incorporating in a comprehensive way the different aspects of the health or disability and related department, coordinating with this department and addressing the societal issues. So let me say something about the social work and in this scenario, like the social work is the profession which is talking about addressing social issues like social justice, human rights, collective responsibility or inequality, addressing community issues, poverty, as well as several other area of human rights like that, in a comprehensive way, coordinating, absorbing various knowledge from other related branches. So the profession, we have the social work department or the faculty. We have to think about the 21st century vision about social system. Our UN Nations recently declared the 2030 agenda for the global sustainable development vision. So in that sustainable development, actually it is mean for sustainable development. That means the without compromising the environment, resources, or such kind of thing, humans and the ecosystem has to survive, lives today as well as meet the tomorrow's needs. And also we should not anyhow it disturb the environment, or it has to protect the entire humanity throughout the centuries as well as yet to come. So in that perspective, the sustainable development perspective, one important, that is among the 17 sustainable development goals, 16th is zero discrimination, inclusive society. Such kind of ideas were highlighted, which has very much the social work, behavioral sciences has very much contributed in that perspective. So in that line of the now has various issues, differences. The differences in the sense that these are communal level differences, individual level differences, political level differences. So the vision suggests that the society of inclusive of all differences. That means discrimination. That means society is absorbing anybody, even any without race, economic or political or caste or creed or like. Everyone has function in an optimum way, optimum potential. They should live in an optimum functional level. So that is the concept of the sustainable development goal in the human race or this societal development. It envisages in such a way. So School of Behavioral Sciences are absorbing this kind of these principles, and whatever we could do in a social transformation, we will work in that line. So we have a social work department in our School of Behavioral Sciences. We have recently started a social work program, that is MA in social work, disability and action. So that program is a Rehabilitation Council of India approved program. It's a professional program. It will provide a licensed or professional degree to the aspirants. So we have looking forward to discuss various aspects during the current scenario, social scenario, like the pandemic is a global phenomena.
Hello, sir.
Every country, every nation. Yes.
Hello.
Yes.
Sir, we are
Can
running
you
out of
conclude?
time. Yes, sir.
Okay, I will conclude now. Okay, so in this perspective, the webinar is organized, and I wish all the success to this program, as well as I welcome our Honorable Vice Chancellor to this program. Okay, thank you all. Thank you.
Thank you, sir. Thank you for your valuable words. Next, we have the inaugural session of our program. We have definitely got hold of the most eminent person for the inaugural address. 1 second, Raju sir, are you on mute? Can all the participants mute? Okay, we have definitely got hold of the most eminent person for the inaugural address, Mr. Manyalankurri Ali, who is an Indian politician and previous minister in the government of Kerala. He was elected to Kerala Legislative Assembly from Perindalmanna of Malappuram district of Kerala. He was the chairman of Mahakavi Moinkutti Vaidya Smaraka Trust and director of KSFTC and Norca Routes. He have also proven himself.
Buddha, enough. That's fine. Call me, please. Yeah.
Okay, sir.
Okay.
You can take over the mic.
Thank you. Dear Dr. Rajiv Kumar, Dr. Balagopal, Dr. Mishal, Buddha Ali, and other friends. I must confess before I start that I thought that the meeting is tomorrow, and I haven't prepared a speech for today's occasion. in English especially. So I will convert to Malayalam, I think, if you don't mind. ഞാൻ ചെയർമാനായിക്കൊണ്ടിരിക്കുന്ന ഈ കോളേജിൽ ഇതേപോലെ ഒരു വെബിനാർ സംഘടിപ്പിച്ച നിങ്ങൾ എല്ലാവരെയും ഞാൻ ആർദ്രമായിട്ട് അഭിനന്ദിക്കുകയാണ്. വാസ്തവത്തിൽ ഇത്രയും വലിയ ഒരു വെബിനാറിൽ ഞാൻ ആദ്യമായിട്ടാണ് പങ്കെടുക്കുന്നത് എന്ന് കൂടി ഞാൻ പറയാൻ ആഗ്രഹിക്കുകയാണ്. വളരെയധികം പ്രധാനപ്പെട്ട ആൾക്കാർ, ഡോക്ടർ രാജീവ് കുമാറിനെ പോലെ, അതുപോലെ തന്നെ നമ്മുടെ VC, അതുപോലെ തന്നെ മറ്റുള്ള ധാരാളം ആൾക്കാർ വന്ന് ചേരാനുണ്ട്. ഇപ്പോൾ തന്നെ നമുക്ക് വി ഹാവ് 95 പാർട്ടിസിപ്പൻസ്. അപ്പൊ അതൊരു വലിയ കാര്യമായിട്ട് ഞാൻ കണക്കാക്കുകയാണ്. വെൽ ഡൺ. അത് ഇതേ രീതിയിൽ തന്നെ മുന്നോട്ട് പോകാൻ കഴിയട്ടെ എന്നാണ് എനിക്ക് പ്രാർത്ഥിക്കാനുള്ളത്. വേറൊരു കാര്യം, ഈ കോവിഡ് എന്ന മഹാമാരി ഇതേ രീതിയിൽ നമ്മുടെ ലോകത്തെ തന്നെ ത്രസിക്കുന്നത് നമ്മൾ ആരും വിചാരിച്ചിട്ടില്ല. ഞാനൊക്കെ ഇത് ആദ്യം കേട്ടപ്പോൾ നമ്മളൊന്നും ഒരിക്കലും ഇന്ത്യയിലേക്ക് വരില്ല, ചൈനയിലാണത് ആരംഭിച്ചത്, ഇന്ത്യയിലേക്ക് വരില്ല, ഇന്ത്യയിലേക്ക് വരികയാണെങ്കിൽ തന്നെ പ്രധാനപ്പെട്ട നഗരങ്ങളിലുണ്ടാവുക. പക്ഷെ നമ്മളൊക്കെ അത്ഭുതപ്പെടുത്തിക്കൊണ്ട് ഇത് ലോകത്ത് മുഴുവനും ഒന്നടങ്കം പെട്ടെന്നാണ് വ്യാപിച്ചു. അതോടുകൂടി തന്നെ നമ്മളെല്ലാവരും നമ്മുടെ മുഖം കവറിട്ട് നടക്കേണ്ട ഒരു സ്ഥിതിയിലേക്ക്, ഒരു മാസ്ക് ധരിച്ച് നടക്കേണ്ട ഒരു സ്ഥിതിയിലേക്ക് എത്തി എന്ന് പറയുമ്പോൾ നമ്മളൊക്കെ സംബന്ധിച്ചിടത്തോളം അത് വളരെ ആലോചിക്കാൻ പോലും പറ്റാത്തൊരു കാര്യം. ഞാൻ എൻ്റെ ജീവിതത്തിൽ ഒരിക്കലും ഇതേപോലൊരു സിറ്റുവേഷൻ ആലോചിച്ചിട്ടില്ല. നിങ്ങളും ആരും ഇതിൽ ആലോചിച്ചിട്ടുണ്ടാവും ഞാൻ വിശ്വസിക്കുന്നില്ല. ഇനി ഇപ്പം എല്ലാവരും പറയുന്നത് എന്താ, ദിസ് വിൽ കണ്ടിന്യൂ, വി വിൽ ഹാവ് ടു സ്റ്റേ വിത്ത്, വി വിൽ ഹാവ് ടു ലിവ് വിത്ത് കോവിഡ് എന്നാണ് പറയുന്നത്. അതിനി എങ്ങനെയൊക്കെയാണ്, എത്ര കാലം, എന്തെല്ലാം മാറി എന്തെല്ലാം വരുമെന്ന് എനിക്കറിയില്ല. പക്ഷെ ഈ കാലഘട്ടങ്ങളിൽ നമ്മുടെ സോഷ്യൽ വർക്കേഴ്സ് കാണിച്ചു കൂട്ടിയിട്ടുള്ള ഈ കാര്യങ്ങളുണ്ടല്ലോ, അത് നമുക്ക് പറയാതിരിക്കാൻ നിവൃത്തിയില്ല. യു ഹാവ് ഡൺ എ വണ്ടർഫുൾ ജോബ്. ലോകത്തെ എല്ലാ സ്ഥലത്തും അങ്ങനെ തന്നെയാണ്. പ്രത്യേകിച്ച് മലയാളികൾ, ഞാൻ ഇതിൽ വേറെ അതർ സ്റ്റേറ്റ്സ് മറ്റുള്ളവരൊക്കെ ഉണ്ട്. ഇന്ത്യക്കാരല്ല ഞങ്ങൾ പറയുകയാണെങ്കിൽ പ്രത്യേകിച്ച് നമ്മുടെ മലയാളികള് നമ്മളിവിടെ വളരെ വലിയ അത്ഭുതങ്ങൾ തന്നെ സൃഷ്ടിച്ചിട്ടുണ്ടെന്നുള്ളതാണ് സത്യം. ഇപ്പൊ ഗൾഫ് നാടുകളിൽ നമ്മൾ ഏകദേശം 30 ലക്ഷത്തോളം വരുന്ന ഇന്ത്യക്കാരുണ്ട്. ഈ 30 ലക്ഷത്തോളം വരുന്ന ഇന്ത്യക്കാർ ഇത് പെട്ടെന്ന് ഗൾഫ് നാടുകൾ വളരെ സ്ട്രോങ് ആയിട്ട് വന്നപ്പോൾ അവിടെ സോഷ്യൽ വർക്കേഴ്സ് അല്ലാത്ത, അല്ലെങ്കിൽ സോഷ്യൽ വർക്കേഴ്സ് അത് ട്രെയിനിങ് ഒന്നും ലഭിക്കാത്ത ആൾക്കാർ, മനസ്സിൽ സോഷ്യൽ വർക്കുകളുടെ ആൾക്കാർ പുറത്തിറങ്ങി അവർ സഹായിച്ചതിന്റെ അടിസ്ഥാനത്തിലാണ് അത് വളരെ വലിയ രീതിയിൽ കൺട്രോൾ ചെയ്യാൻ പറ്റിയത്. അവർക്ക് അവിടെ മൊർട്ടാലിറ്റി റേറ്റ് വളരെ കുറവാക്കാൻ പറ്റിയത്. അപ്പൊ നമ്മുടെ പല സംഘടനകളും ഉണ്ട്, മലയാളി സംഘടനകളൊക്കെ അതിൽ മുമ്പ് നിൽക്കുന്നത്. അങ്ങനെയുള്ള ധാരാളം ആൾക്കാർ ഒരുമിച്ച് നിന്ന് പ്രവർത്തിച്ചതിന്റെ അടിസ്ഥാനത്തിലാണ് ഇത് വന്നത്. പക്ഷേ നമ്മുടെ കേരളത്തിലേക്ക് വരികയാണെങ്കിൽ നമ്മളെ മറ്റുള്ള ഇവിടേക്ക് വരുമ്പോഴും നമ്മളുള്ള കാണുന്നൊരു വലിയ പ്രശ്നം, നമുക്ക് ഒരിക്കലും
I couldn't understand.
Sorry.
Please
I will
speak English.
translate to you later because it is very difficult for me to speak in English. That is the thing. I haven't prepared for this meeting. In fact, like I told you, I confessed before I started. So I will not continue this for a long time. I will stop it for you. I mean, I will give you this thing later on. So what I want to say is that the people in Kerala, especially in the world and everywhere, they have done a fantastic job, but they are not getting the reward from the society and from the government and all properly. That is one thing which I wanted to tell you. എനിവേ, ഞാൻ മറ്റുള്ള കാര്യങ്ങളൊക്കെ ഒന്നും തന്നെ പോകുന്നില്ല. നിങ്ങളെല്ലാവരും ധാരാളം ആൾക്കാരിവിടെ ഉണ്ട്, അവരൊക്കെ സംസാരിക്കുന്നുള്ളത് കൊണ്ട് ഇതിന്റെ ഔപചാരികമായ ഉദ്ഘാടനം നിർവഹിച്ചതായി അറിയിച്ചുകൊണ്ട് ഞാൻ വാക്കുകൾ സംസാരിക്കുന്നു. അഭിവാദനങ്ങൾ. താങ്ക് യു ഓൾ.
Thank you, sir. Thank you for being with us.
Please tell that lady because I haven't prepared for this speech. Okay. Thank you, Uda.
Okay, sir. Thank you, sir. Sorry for the inconvenience to all the participants. He was not prepared. That is the reason he was speaking in Malayalam. Next, we have already completed the inaugural session. Next, we have Honorable Vice Chancellor from Mahatma Gandhi University. One second, Rajiv Kumar sir, can you mute yourself? Thank you, sir. Next, we have the Honorable Vice Chancellor, Mahatma Gandhi University, Kottayam, Kerala, Professor Dr. Sabu Thomas. I invite Professor Dr. Sabu Thomas for the keynote address. Hello, am I audible?
Sabu sir, sir, can you join here? Arun, നമുക്ക് സാറിന് ലിങ്ക് അക്സെപ്റ്റ് ചെയ്യാൻ പറ്റിയ?
Hello, am I audible?
Sir, can you join here? Arun, നമുക്ക് സാറിന് ലിങ്ക് അക്സെപ്റ്റ് ചെയ്യാൻ പറ്റിയ? Sir, can you join here? Arun, നമുക്ക് സാറിന് ലിങ്ക് അക്സെപ്റ്റ് ചെയ്യാൻ പറ്റിയ? Sir, can you join here? Arun, നമുക്ക് സാറിന് ലിങ്ക്
He is already
SR is
there.
in the
His
meeting
audio
room.
is on. Only the video is off. He is already there.
He's here. He's here.
His video is off. His video is off.
Very good.
Welcome, Sabu sir. Sir, your voice is not audible. Are you facing any technical issues, sir? Sabu sir?
Mishat, I think his audio has got a problem from his side, not from your side.
Yes.
And
Yes,
the video
yes.
also, even if we can see his video, then we can see that some problem is there. But his video is
Okay.
also off.
Huda, yes. Huda, we'll do one thing. We'll go with another presenter. Then we will, when Sabu sir join, we'll ask him to talk. Okay. Carry
Yes,
on.
sir. We can move on to the felicitation. We have Dr. B.G. Unni, Academic Director and Research Director of GEMS Arts and Science College, Malappuram. I invite Dr. B.G. Unni for the felicitation.
Thank you. Huda, this is something very unexpected for me to speak. I've heard about Rajiv Kumar, but in between there was interruptions. So I could not follow what he was talking, but little bit I could listen. Maybe the technical problem. People talk about digital, but here when you come to the stage of the peak point, digital is always failure. So it is all. That's the reason I said the online teaching, how far it is going to be success, I don't believe it. I think that face-to-face interaction in the classroom, this will be good. Same thing like here. Thanks to our chairman, Dr. Shri Manjula Kulia Ali. In fact, he talked some of the points, very touching, though it was in Malayalam. But since the program was in Kerala, and also he said that he could not prepare it well. But many important points he touched. Then I was expected to listen Professor Sabu Thomas, the Vice Chancellor of Mahatma Gandhi University. I think again there is a technical problem. The topic organized by the social sciences or the sociology department of our college in association with MG University. It's a very good attempt. In fact, this may be, I think, the 10th, 9th or 10th webinar. They are organizing it. Very good participants. And something which is very important, whenever you have a webinar, when it gives a wide publicity, you should always expect a participant from other parts of the state. So we have to use the common language. But that does not mean that when the Prime Minister goes abroad, he talks in his own mother tongue. So here also there is it's not there, but what you have to do, somebody should be available to have some sort of a translation system, so that whatever the main points chairman said, his very important points he mentioned, can be translated immediately after his talk. That's what happened when the president speaks, the government of India, you always get in Malayalam, you always get in Hindi too. That's when Modi speaks, you always get in both the languages. Same thing, you please make it whenever the chairman or the vice chancellor, or you please make it whenever the chairman or the vice chancellor or anybody from the own state speaks in their mother tongue. Try. That's also a sociological problem, because people want to listen what they speak. So the seminar is very good. And that's a very serious problem as far as the COVID-19 is that how much problem the teaching community is facing. Someone has talked from Tata Institute of Social Sciences couple of days back, organized by the James College. And before that, how much the students are facing it. There's so many problems as far as the social workers' point of view. And they are in fact, the pillar of the situation now, what people are facing it as compared to the general public. So the awareness program is very important. Considering all these points, the topic what we selected now, Mahatma Gandhi University along with the James College, is very good. And I also seen the profiles of the speakers. Very good. Rajiv Kumar also touched many points, but unfortunately in between a lot of disruptions that not follow. Otherwise, every point he has mentioned and the final outcome of these speakers will be very much useful, and such webinar is very much necessary as on today. I don't want to speak much on these points, and again I congratulate MG University and James College for organizing such excellent and very beautiful and going to be a very informative webinar for the students as well as for the faculties. Thank you very much.
Thank you, sir.
Thank you, sir. Thank you, sir. Sabu Thomas, sir.
Once again, Arun sir, Sabu sir is here or not? Shall we start our section or we'll wait for some time?
No, sir. We are trying to connect.
Okay, so then
no
we
need to wait.
Already time. Yeah, time is already 10:45.
Okay,
so
sir.
We
can go for
this
next steps.
Yeah. Thank you, Arun sir.
Okay. While conducting a webinar, it is important to understand the relevance of the selected topic and to analyze the outcome of the webinar. It is also important for the audience to understand how attending such webinars will help us to learn about different aspects of our profession. Let us invite Dr. Mishad Rahman TM, Head of the Department, Defense Arts and Science College, to talk a few words on the scope of our webinar.
Thank you, Huda. Am I audible?
Yes, sir, you are audible.
Okay, I'm not using my video because I have some technical issues. If I on my video, it will fluctuate. So I'm not taking much time regarding because our resource persons are waiting. So I'll describe why we are conducting this webinar, especially during this COVID pandemic. As we all know, coronavirus pandemic, which was first reported in the city of Wuhan, it has dropped global economy and also as well as caused death of thousands of people while leaving millions infected and vulnerable. Among those affected persons, there are some societies often marginalized and excluded populations. We can term them like older adults or already persons with in kind of development impairments, and also with other kind of like vulnerable groups like women, children, etc. So these marginalized segments of the population were the hardest hit by government response measures on COVID-19 because it significantly impacted upon their way of life. We need a well-supported, appropriately equipped, as well as empowered and protected social service workforce to mitigate the damaging effects of COVID-19 pandemic. We, the professional social workers, can build on their existing strong ties to children, families, and communities to rapidly respond in ways that are effective. Okay, and also we are as the respected inaugural address done by our honorable chairman of the GEMS College, Manjalangudi sir mentioned, social workers are doing a good job all around India, especially in Kerala also. But the social work profession, more than any other, is most hurt by the coronavirus pandemic because this pandemic has undermined the profession's historical value, commitment to social justice and human rights, while overturning our insistence on the importance of human relationship. Social workers, like many health and behavioral health professionals, are also concerned about the impact of coronavirus on their well-being the people to whom they provide services, their families, and others in the community. Same like social workers must look after their own and each other's mental health and psychosocial well-being. During a pandemic, there are many sources of anxiety and stress for everyone, including social workers. These may include fear of infection, financial insecurity, job security, heightened concern for their own families, increased childcare responsibilities, and also as we all know, it result from these school closures. We are facing so much of difficulties in child caring. So all these are reflecting upon the social workers' stress also, and also fear of infecting family members, as the social workers are frontline workers and they are working in the community. So the social workers who are under extreme stress or suffering from anxiety may exhibit a range of psychological symptoms too. So as a profession, we have witnessed many times how crisis situations present opportunities to rebuild better, more inclusive and more stable society. Our role as a social workers is to bring attention to the long-term social solution. This crisis is no exception. Social workers at every level have the skills and capability to not only address safety for today, but to transfer or translate fear, grief, and loss into empowerment and social transformation. So I am concluding my scope of this webinar by saying although the International Professional Body of Social Workers, we have International Federation of Social Workers, have drawn connections between the profession and the global pandemic, but there are seldom any evidence to suggest how to cope up with stress faced by the social work professionals. To strengthen these integrations, this national webinar aims to expand on the IFSW statements by highlighting the interlock between COVID-19 and social work, further to provide guidance and possible measures to how to support the professional social workforce and empower them to safely serve children, families, and others in the communities during this COVID-19 pandemic. Thanks for the opportunity. Over to Huda.
Thank you, sir. We have Sabu Thomas sir with us. Professor Dr. Sabu Thomas sir is the Vice Chancellor of Mahatma Gandhi University, Kottayam, Kerala. I invite Professor Dr. Sabu Thomas sir for the keynote address.
Very good morning to all of you. Let me first apologize for the delay because I was chairing a session, an international meeting on COVID-19. And the meeting is going on. I was chairing a session, just got over. So my strong apologies. Congratulations to the faculty members of School of Behavioral Sciences, particularly the director of the school, Dr. Rajiv, and colleagues, and all my teachers and students of School of Behavioral Sciences. They are doing a wonderful work during this COVID pandemic time. The number of workshops, conferences, symposia to equip our society. We all know that Kerala received international acclaim the way we handle corona pandemic. If you look at the international figure, statistical analysis, you will find that Kerala has a unique position in terms of, based on the total population of Kerala, in terms of the number of people infected as per total population, in terms of number of people recovered with respect to total population. We have a unique position. You might ask why. One of the main reasons is, I would say, decentralized planning. Kerala has an excellent decentralized planning. And because of the decentralized planning, we could trace the COVID patients. You know the triple T model of Korea. You trace, you test them, and you treat them. Because of our grassroots level decentralized institutions, they all helped us. Look at the pandemic when it started. When a few students came from China, they were stopped at the airport. and we could test them, we could send them off quarantine. That really helped. And the second reason is, again, we have a robust primary system, primary healthcare system. That is also extremely decentralized. People can really approach. It is almost free. Look at, if you want to do a COVID testing in the United States, my friend, he is living in Dallas, he said he paid almost 80,000 Indian rupees to do a COVID testing. Look at Kerala has such a beautiful, robust primary free system. Anybody go for testing almost free. That really helped to suppress the pandemic. And again, I want to say one important point, the social capital. Our social capital is so aggressive, so supportive. So that you look at our common, we organized so many lunch for the foods, food canteen for so many of our workers, community level. So what the School of Behavioral Science is doing today is they're organizing a webinar on social work. So all these activities, the social involvement of social capital is very important. So we have to train the people. You know, Kerala also succeeded. The so-called SMB. What is SMB? Whenever when we have this COVID problem, we have effectively introduced sanitization. Washing the hand, you make it everything clean. That is, yes. Sanitization process became very, very active because the involvement of our social capital. And in Kerala, almost 100% people wear mask. That is second M, SMD. We are all wearing mask, but if you go to other parts of the country, no, it's not very vigorous. It's not very active. There are people not wearing masks. This is again because of the involvement of social capital. Look at the distancing. We avoided all crowding of the people. We could control it very well. I would say physical distancing. SMP. P is physical distancing. We could do this because of the involvement of social capital. So we need lots of people to train our society. Therefore, the School of Behavioral Science is doing a wonderful job equipping our people, equipping our social media, our population to face the pandemic. So we need this sort of training, we need this sort of workshop to train our people, to equip our people. So we have series of speakers in this workshop. I request all the participants to be very active, understand the subject well, and transfer the knowledge what you get to other people. Therefore, let us face the corona in a united manner. I'm sure Kerala will have a wonderful position in the global, scenario that we could really prevent this corona very successfully. I wish all the best for this workshop, and I hope that you will all enjoy the large number of speakers. You will enjoy the talks of different people, different experts. Please ask them questions, understand the subject, and please train our fellow beings. And I wish good success. Thank you so much.
Thank you, sir. Thank you for being with us amidst all your schedule. Thank you for your valuable words. With this, we will be winding up our inaugural session, and let us move on to our first session. Before the session, let me invite Mrs. Anju PH, Assistant Professor, Department of Sociology and Social Work, GEMS Arts and Science College, for introducing our speaker for the first session.
Good morning, all. I'm audible?
Yes, miss.
Okay, good morning, one and all. Department of Sociology and Social Work, GEMS Arts and Science College, Malappuram. Department of Social Work, BVM Holy Cross College, Cherpungal. Department of Social Work, AWH Special College, Calicut is conducting the national webinar on social work profession and COVID pandemic, and we are privileged and enthusiastic that we got an eminent professional as our resource person. Let me introduce our honorable resource person of the session, Mr. Francis Moothedan Raphel. He is a global TDR trainer, United Nations, Office of the Drug Control Global Master Trainer, Substance Use Disorder Treatment. He has a master degree in sociology from Kerala University, master degree in childcare and education from Alagappa University in Tamil Nadu, master degree in psychology from Annamalai University, Tamil Nadu, master degree in social work from Vinayaga Mission University, Tamil Nadu. He is a professional certified in international addiction, professional from Global Center for credit the certification of the Colombo Plan. He is an expert in trainer in various countries. He is a member of Indian Medical and Psychiatric Association and International Society of Substance Use Prevention and Treatment, and he is a resource person in Regional Resource Training Center on Substance Use Disorder, sponsored by Ministry of Social Justice and Empowerment, Government of India. It's needed a matter of great honor for me to welcome our speaker of today, Mr. Francis Moothedan Raphel. Welcome, sir. Thank you all. I'm over to moderator.
Thank you, Miss.
Okay. Good morning to all of you. Can you hear me?
Yes, sir.
Okay. You may not able to see me. My video, I have closed it. It's not a technological issue, but the person who introduced me gave me so much of tiles and tails and etc. I am different. I look handsome than Mammootty and Shah Rukh Khan. So my wife told me not to show my face. So it is not a technical issue. It's only a personal issue. Please bear with me. You can hear my voice. Am I right? Hello?
Yes, sir. We can hear you, sir. Please continue.
Okay.
Your handsome, sir.
Yeah.
We like to see you, sir.
Yeah. I want to show myself, but my wife, the only one wife, because I am a social worker, I cannot afford more, has told me not to show myself to you. Okay.
You are really handsome, sir.
Yeah, thank you. Now what I want to tell you, don't be too serious in life. Don't be too serious in life. I mean, we all sit down like a very serious person and we never crack jokes. We never use our sense of humor in life. If you are a social worker, the greasing thing in your life is humor. And I try to be cracking humor. Meanwhile, all my sessions, it may not be humor for you, but it may be humor for me. So bear with me. And also I have some suggestions like whenever I ask you to unmute yourself, please unmute. So shall we start? Shall we start?
Yes, sir.
Yes, sir.
Okay. Can the coordinator, can you unmute everybody? Unmute everybody because I am going to do a small exercise. You see?
No, yes, sir. It will be.
Yeah. Now, is there anybody who is speaking Hindi? जो हिंदी में बात करेंगे? इसलिए क्या करना है? तालियां बजाना. Everybody, please clap. Come on. Clap for yourself. Clap. Now lift your hands up and clap, please.
Yes.
lift your hands up and clap. Put your hands down and clap. Put your hands down and clap. Put your hands on the right side and clap. Hands on the right side and clap. Now clap on your shoulder. Now clap on your shoulder. Now clap on somebody sitting near to you. Yeah. Okay, good. Good, thank you. Please mute yourself. Come on. Please mute yourself.
Okay.
Yeah. Now, please share the slide. The organizer, please share the slide so that I can start. Otherwise, I have to start without slides. No, yes, thank you. Please put it in the slide mode. Slideshow. Okay, very good. So, friends, I follow a different method. I asked all of you to clap. Why I said clapping is one of the best methods to refresh yourself. As a Keralite, I have seen others and myself not appreciating my own work and others' work. Whenever I switch on the televisions or any YouTube channel that come from Kerala, I always see the Keralite always express negative feelings. I am 55-year-old young boy. You know, in my 55 years, I have never heard anything that is positive. Always these channels, these TV channels, the discussions speak negatively, pessimistically. I request all social workers, be optimistic, because I am dealing with the topic called occupational stress. Occupational stress comes from within and external. External things we may not able to handle. It's out of our control. However, internal things we can control. So when internal things means controlling, managing your own feelings, emotions, ideas, outlook, etc. Today we are discussing about occupational stress about social worker. You see the picture which shows the social worker is doing multitasking, a lot of work at the same time. That's the reason probably we social workers are called jack of all trades. If you know, if you have ever heard from your professors. When I did my BSW in 1986, the first thing my professor told me, if you want to become a social worker, a professional social worker, be a jack of all trades. What does it mean? Jack of all trades means a person who is capable of doing multiple things simultaneously. We all of us are like that. But you see the picture. Lot of work the social worker does, but he does pittance, a small amount of honorarium. You see the salary written there, $49. So that means we do a lot of work, but we don't receive proper remuneration, proper salary. Like our keynote address person was telling about Kerala and social workers doing very wonderful things. But I wanted to tell him, social workers are paid very low. They are finding it difficult to make the ends meet. So the stress comes from within as well as stress comes from the job. When you are not paid well, when you are not taken care, the stress comes in. So that is the stress we are discussing. Now let's go to the next slide, please. Let's go to the next slide. Stress that are related to your work. No, the previous one. The previous one, please. Hello? The previous, yeah. Stress comes from within. Yeah, the next one. Stress comes from within, and stress also comes from the work. Work-related stress is because there are a lot of demands. Why you are keep changing? Yeah. Work-related stress come from the demands, the pressures, and sometimes our knowledge and the work does not match. Means the work that are given to us does not match the knowledge that we have acquired. Then the stress comes in. There are so many other circumstances where the stress comes in. Sometimes from the pressure, the challenges that we have to take, the organizational pressure, the supervisor's pressure, the colleagues' pressure, the demand of the society, all these things add fuel into the stress that we are undergoing. Next slide, please. Next slide, please. Hello? Yeah. What are the symptoms of occupational stress? How do you know you are experiencing occupational stress? Occupational stress comes basically from within, not from external side. Why I say it is basically from within? When you are given a job, if you love the job, if you like the job, if you are dedicated, committed to the job, it doesn't matter how tough, how difficult the job is, the task is. So there should be a motivation. And we are, as social workers, are always motivated to do work. So if you have lack of motivation, the stress comes in. If you have a general feeling of stress, like there is confusion, there is chaos, there is total misunderstanding about the work that you are doing, stress comes in. Anxiety, like sometimes it happens, you have physical issues, say hypertension, say diabetic mellitus, that is diabetes. If you have these physical issues also, you can have stress. You can also have stress, like you are feeling inferior to your co-workers. This is a big issue among we, the social workers, because we are always trying to be the number one. We are always trying to be the first rank holder. I would request all the social workers, please do not create unnecessary stress on your co-worker by trying to be the number one. Social works comes from Gita, the Puranas, where we are taught we are not the highest or the lowest, but we are equals. So the pressure that you give to your colleague, that when you make him inferior, when you make him feel inferior, he feels a lot of stress within the social work system. Then a person changes his diet. He doesn't eat, he doesn't care for himself. That is a symptom or a sign of stress. Then insomnia, the sleeplessness, irritability, easily getting angry. Then like depression, feeling of hopelessness, dejection, failure, etc. All these things are symptoms of stress, occupational stress. Then, occupational stress also include signs or symptoms like anxiety disorder, depression, etc. So these are the symptoms of occupational stress. Let's go to the next slide because we have limited time. Please go to the next slide. Hello, please go to the next slide. Hello, please go to the next slide. Can you hear me? Yeah.
Sir, I can hear.
Yeah. Burnout. Burnout is one of the major things that a stressed person always experience. Burnout का मतलब क्या है? Burnout का मतलब क्या है? हम गाड़ी चलाते हैं, चलते गाड़ी का इंजन स्टॉप हो जाता है, उनका इंजन ऑयल खत्म हो जाता है, इसको बोलते हैं burnout. What do you say burnout? When we drive a car, all of a sudden the engine oil stops, get finished or gets depleted. So burnout means our engine oil gets depleted. We are no more operative. We become inoperative. It is difficult for us to continue working because we do not have the energy to work. So what happens when engine oil finishes in a car? The driver stops the car, switch off the engine for a while, and then refill the engine oil, and then he restarts. Likewise, when you experience burnout, doesn't matter where you are working, doesn't matter where you are a volunteer in the pandemic services, please stop your engine. Take a while, refill your engine, then restart. That's the best method to avoid burnout. Let's go ahead. Next slide. What are the areas or aspects that you need to be very careful when you experience stress? When you experience stress, please remember, these are the areas you need to check and evaluate. Check yourself, your physical needs. Are you taking proper food? Are you on diet or you are taking nutritious food? Eating properly? Taking proper fluid, water? Sleeping properly, etc. You need to check. If you are becoming too lean or too fat, your tummy, that is your stomach, is becoming bigger and bigger, all these are certain indication that your physical energy, your physical health is not okay. It may be due to the stress that you are experiencing. So change your diet, do some exercise, go on swimming. See, people say you go jogging, walking. I would suggest to you the best exercise, the best physical exercise is to go swimming. Jump into a river, jump into a nala or a pond, swim for 15 minutes every day. Your burnout can be handled very well. Then the emotional areas. You see, the emotional areas, when I speak, very often, many of us are not emotionally matured. Like IQ, there is EQ. there is also SQ. So your EQ must be proper, must be able to handle in a better way. So check your emotions. Are you easily irritated? Are you easily depressed or anxiety, crying for a small things? When your supervisor calls, do you cry? Do you easily become sad? When your supervisor does something that is not expected of him, do you get easily angry? Then your emotion is not okay. Check that. Then the behavioral side, that you behave in a immature manner. You don't behave properly like an adult. Remember, we are not only an adult, we are social workers. Social workers means what? People understand himself, people understand themselves, and also understand others. So the word understanding is more important for us social workers. So check your behavior. Also, when you feel more stress, check the work that you are doing, the workload. Are you doing a lot of work that is beyond your capacity? Are you doing a work that is beyond your capability, beyond your energy? Then stop. Don't do it. Because that can cause you, that can take you into more stress and then lead you to total collapse. Please stay in the next slide. Let's go faster. This is another word used among social workers very often. The stress that comes from this concept, that is called compassion fatigue. What is compassion fatigue? We social workers do a lot of empathetic services to other people. Sometimes what happens, we are over enthusiastic, over committed, over dedicated, so we spend all our energy using empathy for other people. When you use your empathy in an extraordinary way, exhausting yourself, you become tired. You become tired of being empathetic to other people. That state is called compassion fatigue. This compassion fatigue can make you ill, can make you unhealthy, and lead yourself into trouble. So you must check whether you are experiencing compassion fatigue. Excessively, you are using your empathy for other people. This happens whenever you work with people who are undergoing lot of personal pain, lot of personal trauma, lot of personal tragedies in their life. An example I tell you, during the tsunami time, you know the tsunami? During the tsunami time, a professional social worker happened to work with the people who lost their houses. And the social worker saw that the people in that coastal area are suffering from a lot of things. So what he did, he started helping them in all the way that he could. He didn't go his home. He didn't even mind to eat. He did not take care of himself. He did not even call his family members, but he always remained with those people who are suffering. You know, empathy means what? Putting your legs into others' shoe. So he always tried to put himself in their situation. As a result, he experienced the trauma that they experienced. So what happened? This was excessive, over empathy, chronic empathy that he experienced. So that is called a compassion fatigue. If you are experiencing this stage, please stop and then refuel yourself, refill in petrol. Wait for some time and then work on. Next slide, please. Hello, can you all hear me? Is it okay?
Yes, sir.
Yes, sir.
Yes, sir. Yes, sir.
Yeah, I just want one of you to say, have you ever experienced compassion fatigue? Did any one of you ever experience compassion fatigue? Hello? Nobody's. Hello? Did you ever experience compassion fatigue?
Sir, can I speak?
Yeah, please, sir. Please, sir.
Yes, sir. Actually, when I'm into teaching profession, so when I come across students who are unable to pay their fee or who are struggling with so many personal issues, despite that coming for studies, I've always felt compassionate. But sometimes now I've become burnout also because of the same, that the problem of not being able to help or not being resourceful to such kind of students sometimes has put me into a kind of fatigue, I could say.
Okay. Sir, Alan Godfrey. Thank you, sir. You are exactly right, sir. But what I want to say as a professional social worker, actually, are you doing charity or a social work? You know, social work is mistaken for charity. We are not doing charity. We are doing social work. Means we don't give anything free. We only give ideas, we teach skills, we give training so that they become self-sufficient. Atmanirbhar. Like what happened in Mahabharata, in Bhagavad Gita, where Arjunan was reluctant to fight against his brothers. Lord Krishna told him, you remember the famous wording, Yada yada hi dharmasya glani bhavade abhyuddhanam. What he said, whenever there is adharma comes in, the Lord comes in to fight against dharma. By telling that what Krishna did, Lord Krishna did not fight for Arjuna. Rather, Lord Krishna gave a kind of strength, an idea to Arjuna so that he fight himself. He fight for himself. Krishna directly did not involve in the war. He was supporting him. Like what we say in social work. Social work means not giving a fish, but teaching how to do fishing. This compassion fatigue comes when we are trying to give fish, not teaching to fish. Alan sir, you feel empathetic towards your students. That is good, but this is what I want to tell you. There are so many poor people on this earth. We cannot help them all. Like I used to tell, there are so many beautiful girls in this world of beautiful nature who cannot pay their dowry. That doesn't mean that we marry all these girls without dowry. We only help them how to manage their dowry. So that is what the social workers should realize, The moment that you realize this concept that we are not doing charity, but we are doing social work. Social work means not giving fish, but giving only a fishing rod. When Alan sir said he experienced this compassion, I don't blame you or I don't say anything negative about you. Your feeling is good, but I want to say the more you feel like this, the more you feel compassion fatigue. That's what I want to tell you. Thank you.
Thank you.
Yeah.
Thank you.
Yeah. Now let's go to the next one. Job stress. Because I have time. My time is up to 11:45. I'm checking always the time because I want to finish on time. So let me go ahead. Job stress. Job stress means what are the job stress that you can have? One is role conflicts. This is very common in our social work. Even the advertisement says, wanted social workers. And they write under that, responsibilities. Preparing project, reporting to the manager, and then finally they write, whatever the director asks of you. You see, the roles are prescribed, but towards the end they say, as directed by the director. And in the social work setting, what the director asks you, you are a social worker with an MSW, with an MPhil, maybe with a PhD. You are the coordinator of that project. But all of a sudden, the driver didn't come. Because nowadays he has got corona or he is in quarantine. And you know, the director will ask you, hello Alan, can you drive? Can you please drop me in the railway station? Just one moment before, you were the coordinator of that project. Now you are the driver of the project.